Hello, my name is Marion. This presentation addresses approaches to developing competency-based education, CBE, which prepares both new graduates and workers in different settings to achieve positive outcomes from their education and their performance in work settings. My background is in nursing education, so I will use examples from nursing and health related programs throughout the presentation. The principles of CBE are commonly used in all types of educational programs from K-12 at the college level and in workplace settings where employees have development programs related to their performance. The need for CBE has been recognized, discussed, and implemented in many settings. In the United States, competency-based outcome programs were first adopted in 1994. Today, there are many programs in place. CBE is a multidisciplinary approach to competence. Educational institutions and providers need evidence that anyone who completes a degree or course has achieved a required level of competence. Accrediting, regulatory, and professional groups want assurance that completion of an educational endeavor indicates competency. There is greater accountability for the costs and time it takes to complete educational endeavors and determine if students achieve the expected outcomes. Employers may have to hire new workers who do not have basic competencies required for entry-level programs. Employers invest in extensive training programs to address the initial needs of new employees and the continuing training needs of all employees. Knowledge workers need to function in complex, changing work environments. Regulatory, legal, external standards, and quality measures require demonstration of competence. Workers need to continue their own personal and professional development to advance their careers and make positive contributions to organizations. Each organization or group will have to decide on the definitions and approaches to determine how a competency model fits with their mission, goals, and philosophy. So, what is competency, competence, and performance? There are two perspectives related to the meanings of competency and competence. Competency focuses on an individual's ability to perform job-related activities. Competence describes actions or skills the person can demonstrate. Performance relates to specific behaviors that are measurable and can reflect what workers actually do. There is some general agreement about the characteristics of competency-based education, CBE. They include acquisition of essential cognitive, psychomotor, and affective skills, continued development of skills. Broadly based, competency development is derived from the best professional evidence, current standards, and regulations. Authentic assessments which are valid and reliable. The use of adult learning principles and individual learning styles and abilities are recognized and appreciated. Features of competency-based education include applicability at the course, program, and institutional levels. Participation of internal and external stakeholders into determining the desired knowledge, skills, attitudes, and dispositions important in diverse work settings. Developing assessments that are based on specific competencies. Support for the development of learning experiences and assignments that help students become proficient in the competencies essential to different disciplines and settings. Employees who are hiring new graduates raise the following concerns related to post-secondary education and employability. First of all, degrees signify competence only in a major area of study. The competency focuses on the cognitive and knowledge levels. The application level may be weak. Specific competencies are not identified and included in curricula. College transcripts list course titles rather than specific competencies. Graduates do not highlight general or specific competencies in their resumes and interviews. Institutions of higher education are recognizing that their approaches to accountability, articulation, student transfer concerns, and employability issues are the reasons for considering movement to CBE. Many panels and commissions have identified and share lists of foundational and advanced competencies. They generally include basic skills: reading, writing, mathematics, speaking, and listening; thinking skills, thinking creatively, decision-making, problem-solving; and personal qualities: individual responsibility, self-esteem, social skills, managing self, and integrity. A short version describes 4 basic competencies: managing self, communicating, organizing innovation, and managing change. Sets of general or foundational skills, competencies, have also been identified, and the need for discipline-specific competencies have also been addressed by professional groups. Most post-secondary school graduates need the above skills to survive and thrive in 21st century workplaces. The business and industry communities do not want to dictate curricula or programs, but do want a voice in finding ways to better prepare graduates. Promoting collaboration between educators and workplaces is one way to make improvements. An example of professional competence includes a set of essential, relevant knowledge, skills, and attitudes. For example, consumers and groups interested in healthcare policy were concerned about patient safety and the effectiveness of the healthcare workforce. Using a CBE approach can address these concerns. CBE is especially important in health-related programs. It is essential that providers of all types of healthcare and services are competent to carry out their roles. Health professionals promise competency and have diverse methods to measure it. There are similar sets of competencies for all major disciplines. Another important topic relates to approaches to developing competency-based education. While there are different perspectives on the definition, diverse groups see the need to incorporate common elements if they're going to develop a CBE program. Consumers, regulatory, educational, and practice groups need to establish partnerships. Collaboration and innovation in education and practice settings support the development and maintenance of a competent workforce. Educational systems respond to changes in the complex work environment. Learners have an active role in determining their educational needs. The primary focus is on identifying and measuring specific learning outcomes for initial and continued competence. Required competencies include all the domains required for practice in a discipline. Assessments are leveled, with the learners demonstrating competence at each level. Assessments are done at different points in time using a variety of approaches. Collaboration between education, employers, healthcare providers, and other stakeholders is an essential first step to meet the needs of the changing education and workplace landscapes. This approach helps new graduates in all disciplines to be prepared for entry-level positions. So, what is needed to redesign teaching learning processes? Educational programs in institutions and workplace settings typically use assessments which may focus on selecting responses to test items. The results of assigned assessments may show that individuals may have missed 20 to 40% of the responses but have passed. There is not any way to specifically determine which required competencies were missed. A culture of continuous improvement based on innovations in technologies, teaching learning strategies, and the recognition of learners as active participants is needed. Continued competencies are expected in many disciplines. Public policy initiatives internationally, nationally, and at state levels are beginning to address the public's interest in having assurance that they receive competent quality services. Changes in regulations, standards, best practices, and new evidence all contribute to the need to revise educational offerings. The continued revision of educational programs based solely on updating content is impossible to manage and does not address learner outcomes that demonstrate competence. To overcome some of these barriers to implementing CBE in post-education, there's a need to use a holistic view. Graduates must be prepared to meet current needs of society, but also have the ability to maintain their competence to meet future needs. There are examples of institutions and organizations that have successfully implemented CBE programs. The first example is Western Governors University. It was created as a CBE educational institution. Students demonstrate competence rather than completing discrete courses for a degree. Students have multiple pathways to demonstrate competence. Initial assessments indicate what students know and can do related to the required competencies. The processes for determining competencies and assessments are based on input from external stakeholders, content experts, and experts in assessment and measurement. Maricopa Community College District has an educational model with competencies linked to specific curricula. The development process starts on the campus level in order to have input from internal and external stakeholders. Individuals with different types of expertise, such as content experts, instructional designers, and information technology specialists are all included. The Learning and Assessment Center at Michigan State Universities includes all practice disciplines. The mission is to assess if students are proficient in key tasks and support curriculum changes that are competency-driven. Internationally, there is also interest in CBE. The following examples demonstrate different approaches to implementing CBE-based programs. The programs are developed to address specific health issues in various populations. The World Health Organization is recognized for its efforts on many fronts to improve health of all people. Strategic CBE directions were developed for 2002 through 2008. The Australian Nursing and Midwifery Council first adopted national standards for registered nurses in the early 1990s. The standards are broad and serve as a framework for assessing competency. The National Health Service in the United Kingdom recognized the need for nursing graduates to be fit for practice and fit for purpose. Prior to 2000, the educational model was based on an apprentice principle. The new model retained existing positive practices but includes CBE principles. In the United States, the University of Colorado School of Nursing celebrated its centennial in 1998 and reflected on all the contributions it had made to nursing education in the state, nationally, and internationally. It was time to look at the future of the programs. It is an excellent example of issues, concerns, and questions about the curriculum and processes used to implement a CBE format. All major groups participated in moving the nursing program forward to CBE. Employer focus groups identified deficiencies in preparation of the graduates. The graduates themselves did not feel they had the entry-level competencies required for practice. The faculty determined principles on which to base curricular revisions that would retain the core values of the school. The outcome was the curriculum would be competency-based and outcome-focused, modular and flexible, accessible to learners who desired a degree or lifelong learning opportunities, and would be learner-centered. Focus would be on the real world of evidence-based practice and be technology-based. When planning a new curriculum, it is important to identify the resources needed to support the implementation. Examples are the shared use of resources such as simulation laboratories, technology links for teaching, learning, and communication, agreements for shared student services, agreements for shared academic policies, and shared purchasing of equipment and services are included in the changes. When there is interest and efforts to address competency-based education for all disciplines, there has to be agreement on common terms, definitions, and meaning, and expectations, validation of methods and approaches to measure competence, and collaboration among all parties, the public, educators, employers, professional associations, and regulators. When change is considered, there's always a question: how will it be possible to change employees' attitudes and benefits related to change? Research done by the National Post-Secondary Education Cooperative has described the need for changes to start at the institutional levels. The principal aspects are: senior leadership members are open to change and become advocates for change. Competency-based activities are implanted in the institution organizational culture. Competency assessments are directly related to goals and learning experiences. A diverse group of stakeholders participate in determining the competencies. Staff and experts participate in making decisions about assessment instruments and processes. All types of assessment processes and instruments are carefully evaluated for reliability, validity, credibility, and cost. Competencies are specifically designed so they can be appropriately assessed. Multiple competency assessments provide the data essential for policy and outcome decisions. Critical decisions for improving student learning and employee outcomes are derived from assessment data. Assessment results are collected for individuals and aggregated for meaningful reporting. Institutions and organizations promote experimentation and innovation. Institutions and organizational support for CBE initiatives at all levels and all types of education programs need the help to get the processes started. The need for change is based on many factors. New internal and external expectations, concerns about the effectiveness of current outcomes, and changes in workplace environments are driving forces. Educational programs, professional groups, regulators, and employers have taken on the challenge of redesigning teaching and learning in their environments. The future of CBE will have specific features which include a common model for all workers in all roles. Regulatory initiatives will be pilot tested. The use of technology and evidence will be the basis for workplace decisions and actions. Global approaches to assuring safety and quality of service for individuals, groups, and communities, and society as a whole. Educational programs in all disciplines have the shared responsibility with all other interested parties to prepare graduates who are competent to begin their practice in complex work environments. This can be accomplished through authentic partnerships between educators and external stakeholders. In summary, competency-based education addresses the need to have graduates from all disciplines to be prepared for entry-level positions in all types of workplaces. Educators, employers, graduates, consumers, and external stakeholders can all contribute to making this a reality.